Hello. As the first representative of the U.S. government today, I wanted to begin by reading a statement from President Joe Biden on the passing of Sheikh Khalifa bin Zayed Al Nahyan. He states, "Jill and I were deeply saddened to learn of the passing of His Highness Sheikh Khalifa bin Zayed Al Nahyan. Sheikh Khalifa was a true partner and friend of the United States throughout his decades-long tenure as the President of the United Arab Emirates and ruler of Abu Dhabi, and in his earlier role as Crown Prince of Abu Dhabi. On behalf of the American people, I offer my condolences to Sheikh Khalifa's family and all Emiratis as they mourn this great loss. We will honor his memory by continuing to strengthen the long-standing ties between the governments and people of the United States and the United Arab Emirates." Friends, today we have we're very honored to have with us a real champion of the field of addiction, former Congressman Patrick J.Kennedy. During his time in Congress, Mr. Kennedy co-authored the landmark Mental Health Parity and Addiction Equity Act, which requires insurers to cover treatment for mental health and substance use disorders no more restrictively than treatment for illnesses of the body, such as diabetes and cancer. In 2013, he founded the Kennedy Forum, a nonprofit that unites advocates, business leaders, and government agencies to advance evidence-based practices, policies, and programming in mental health and addiction. In 2015, Mr. Kennedy co-authored the New York Times bestseller, A Common Struggle, a personal journey through the past and future of mental illness and addiction, which details a bold plan for the future of mental health care in America. In 2017, he was appointed to the President's Commission on Combating Drug Addiction and the Opioid Crisis. Mr. Kennedy is also the founder of Don'tDenyMe.org, an education campaign that empowers consumers and providers to understand parity rights and connects them to essential appeals, guidance, and resources. He's the co-founder of One Mind, an organization that pushes for greater global investment in brain research, co-founder of PsychHub, the most comprehensive online learning platform on mental health, substance use, and suicide prevention topics in the world, co-chair of the National Alliance for Suicide Prevention's Mental Health and Suicide Prevention National Response to COVID-19, and co-chair of the Bipartisan Policy Center's Behavioral Health Integration Task Force. Quite a list of accomplishments. It gives me great pleasure to introduce to you Mr. Patrick Kennedy. Thank you so much.
Thank you, Brian. I too want to offer my condolences to the family of Sheikh Khalifa bin Zayed Al Nahyan and thank Brian for acknowledging the great loss to the United Arab Emirates that his loss is, and want to send my condolences to his family and to the people of Abu Dhabi and UAE. I want to begin by thanking Brian for the opportunity to come and speak to all of you and a chance to see a conference that if you told me a conference like this existed, I wouldn't believe you. I had the great honor in my country of the United States to be the sponsor, the author of the most important mental health and addiction law that we have passed in the United States in over the last 50 years. And you might say to yourself, how does someone so young get to be the sponsor of a piece of legislation so important, especially in a community like the United States Congress, where if you don't have a lot of seniority, you don't get to put your name first on any bill. So I want to tell you that I became the sponsor of the Mental Health Parity and Addiction Equity Act by default. I became sponsor because no one else wanted their name on a piece of legislation with the words mental in it and addiction. Of course, how could you blame any of my political colleagues in Congress? If they introduced the bill, the press, the media would immediately ask them, do they have a mental illness in their lives? Do they have an addiction? Or does anyone in their family suffer from it? And of course, if you're in politics, that's the last question you ever want to answer. Because if you say yes, there's 35 more questions. What medications are you on? Where did you go for treatment? And how are you? So, I was very lucky, though. When I was in my second term as an elected official in Rhode Island, I woke up one morning, I went to my local grocery store, and right near the checkout counter was a picture of me with the words Patrick Kennedy, drug addict. And as early in my political career, when I was running for re-election, you can imagine my first reaction was, this was going to be a very short political career. But something happened. I represented a very strong Italian-American community in a little community called Rhode Island, smallest state in the country. And the only thing that my constituents, my voters, hated more than a drug addict was someone who ratted on a drug addict. And so I ended up getting elected the next time when I was up for election. And then I got elected to the United States Congress. And when I was elected to the Congress, I wanted to do something about this issue of addiction and mental illness, because not only had it affected my personal life, it had affected my family's life. My father, Senator Edward Kennedy, who, by the way, was the recipient of South Africa's highest civilian award because of the fact that he led the charge in the United States Senate against apartheid and was able to override President Reagan's veto of that bill. And thankfully, we saw an end to apartheid in South Africa. And my father was recipient of that highest of all South African awards. And I might add, my father was also the awardee for the Chilean government's highest award because of my father's work standing up to Pinochet and the fascist military dictatorship of Chile. And I was proud that my father also won the largest, highest award in Argentina fighting that military dictatorship, and that of Mexico for his work on making sure we had a better immigration system that did not end up persecuting so many of our fellows in our hemisphere who were only seeking a better life in the United States. So I had the chance to ask around to the clerk of the House when I got elected in Washington, where is the legislation that requires that addiction be treated like all other chronic illnesses. And the clerk in the House of Representatives said, "Congressman Kennedy, no one has introduced that bill. If you want to be the sponsor of it, it's all yours." And keep in mind, I came from the smallest state in the country. I was in the minority party, and I was the youngest member of Congress at the age of 27. Yet I got to write a bill that basically said that the brain was part of the body, and that insurance companies ought to reimburse for illnesses of the brain in the same way they reimburse for every other illness of one's body. I wish I could tell you, and for us in the United States, that meant that insurance could not charge higher premiums if someone suffered from addiction, higher co-pays, or higher deductibles, and they could not provide lower lifetime caps than they would otherwise for any other illnesses. And it had to be across all areas of insurance. So I wish I could say we passed this bill because it makes so much common sense. But unfortunately, it took me over a dozen years of introducing this bill before we got it signed into law. And we didn't get it signed and passed because the American people said, it's long past time that we acknowledge this illness of addiction for the illness that it is. We passed the bill because we had a financial crisis in the United States in 2008, and I knew the chairman of the banking committee who was putting together the largest federal bailout of banks in the United States in our nation's history. You remember this 2008 financial global meltdown. So Chris Dodd, who was chairman of the banking committee, wrote the whole Economic Stabilization Act law into my bill, H.R. 1424, the Mental Health Parity and Addiction Equity Act, which means that we passed that bill because we were trying to save our country from another economic depression, not because we wanted to treat the disease of depression. And that bill went for a signature on President George Bush's desk, and I had the honor of joining my late father for the signing of that legislation, because it was on that same presidential desk that my uncle, President Kennedy, signed the original Community Mental Health Act of 1963. John F. Kennedy had a sister, my Aunt Rosemary, who had an intellectual disability and a psychiatric illness. She was given a lobotomy for her psychiatric illness, which exacerbated her intellectual disability. She was the most powerless member of my family. And yet, when history is written, she will go down in history as the most influential member of the Kennedy family, because it was Rosemary Kennedy who was the inspiration behind the International Special Olympics program, which was celebrated here in Abu Dhabi for their 50th anniversary just 3 years ago before the pandemic. And I want to thank the people of the United Arab Emirates for hosting the Special Olympics and helping to pay for over 190 countries who sent their athletes here to Abu Dhabi to compete in those international games. So President Kennedy signed the Community Mental Health Act because he believed that it was community that could restore people to their independence. And he knew that you could always treat people only when you were also including their family. And that is the spirit of Special Olympics and the spirit of the Community Mental Health Act. It said that we should no longer institutionalize people with mental illnesses and intellectual disabilities, that we needed to be able to treat people in their communities. And I know when you look at the principles that you have set down to disseminate best practices around the world for intervention at the primary, secondary, and tertiary levels of care in addiction treatment, community is at the heart of all of those. We cannot treat our way out of addiction simply by looking at it as a medical issue, but it is a medical issue that necessitates medical treatment. We have to treat it as a mental health issue with psychological support, but we cannot treat it alone with psychologists and psychiatrists, although that is important. We also have to treat it for its social impact, or for those of us who are in recovery, the spiritual aspect of a threefold illness, which is a physical allergy, a mental obsession, and a spiritual malady, otherwise known as biopsychosocial. All of those components need to be put together. And as a person myself in a long-term recovery, which for me means that I have not had to drink or drug or use any mind-altering or mood-altering substance since February 22nd, 2011. That means, thank you, it means that I need to have an addiction treatment specialist, not any old doctor, a doctor with addiction education, because I spent my life going to doctors who wrote me prescriptions for OxyContin, which I became addicted to. I went to doctors who wrote me prescriptions for benzodiazepines like Xanax, which I became addicted to. I went to doctors who wrote me prescriptions for stimulants like Adderall, which I became addicted to. And to a person, none of those doctors understood the threat to my health that my disease of addiction was, because in my country, addiction is not listed on the medical chart of a doctor who is supervising your care. Now, when I left Congress because I wanted to get a permanent sobriety date, and I found that being in United States Congress and in Washington, D.C. was not necessarily conducive to a permanent sobriety date, I went to see a new doctor in my new place where I resided, and he asked me about my health, and the first thing I said was, I am a person in recovery from addiction. And there was a blank look on my doctor's face. He was like, oh. And then he said, is there anything else you want to tell me about? I said, yes, I have a history of cardiovascular disease, and I take a statin for my cardiovascular disease. He said, oh, interesting. And then I said, I'm an asthmatic, and I have trouble breathing, and I take an inhaler for my asthma. And he went to his computer, and he asked me, how many times do I wheeze every day? How many times do I take my inhaler? What kind of inhaler do I take? It took me 20 minutes telling him about my asthma. And then he said, is there anything else? And I said, yes, I have back pain. I had surgery on my back. Let me show you my scar. And my doctor looked at my scar and he said to me, that must be very painful. And I said, yes, doctor, do you mind prescribing me some Percocets? And 25 minutes after telling him my main health condition was addiction, he was breaking his prescription pad out to write me a script for a Percocet. And then now I'm 3 years in recovery. And I've got children now, and I've got nieces and nephews, because when you get into recovery, life starts to happen. Family starts coming back. Joy starts coming into your life. Purpose and meaning come back. And I was putting together a ping pong table for my family to play on. And the ping pong table started to collapse. And so I tried to catch the ping pong table, and what ended up happening was that it pinched one of my fingers, the very top of my finger, off, and there was blood everywhere. So I went to the emergency room, and the nurse said to me, what are you allergic to? And I said, I'm allergic to penicillin, and I'm allergic to opioids. The nurse had never heard anyone say they were allergic to opioids. She said, what happens to you when you take opioids? And I said, I break out in handcuffs. You see, I've been arrested multiple times, because wherever I go, I take my disease of addiction with me. And the criminal justice system is the place where most of us end up, because there is not a good public health system to address the disease of addiction. There is not a good medical system to address the disease of addiction. So we wait for the disease of addiction to become pathologized and critical before we ever interrupt it and try to intervene. If this disease of addiction were to be likened to cancer, we would wait till it became a stage 4 illness before we treated it. But we know with cancer, we don't wait till it becomes a stage 4 illness. We get in there and screen early so that we can catch it early, because we all know the earlier you catch it, the better chance you have in helping people recover. One of the reasons there is so much stigma against the disease of addiction is that many people don't recover, because by the time we reach out to them, their disease has become so pathologized. But just think about it. If we were measuring mortality rates for cancer victims, and the only time we intervened with cancer was when people were at death's door, you know what? outcomes for cancer wouldn't be much better than outcomes for addiction. But that's what leads to the stigma by many in public policy leadership positions who say to themselves, we can never wrap our arms around this disease of addiction because in our experience, nobody gets well. I can tell you, if you knew my family and you knew the disease of addiction that ran in my family for generations, and you knew that I had multiple members of my family murdered, you would say to yourself, well, he has the genetic predisposition and he has some of the environmental factors like trauma that can kick it off. So when we treat him, let's make sure we keep an eye on his risk for addiction. What a marvel that would be. Now, when I was getting evaluated young in my life, they said, well, your grandfather died of a stroke. You have cardiovascular disease in your family. They put me on statins, Lipitor. 25 years ago, I was put on Lipitor. And you know why the medical system put me on Lipitor? Because they said I was going to die kind of in my early 70s, 30 years ahead of time, if I did not start taking Lipitor in my 20s and 30s. Now, tell me this. When is it going to be the case where our medical system, our healthcare system, starts treating addiction early by taking a family history of all of those people that a physician in the medical system is encountering to treat? Because if you're not asking for a family history of mental illness and addiction, you're missing probably the most important factor in a person's health and well-being. Because there is no way that they are going to be well cardiovascular disease-wise, diabetes, asthma, cancer, you name it. None of those illnesses get better if you're not treating underlying depression, anxiety, and addiction. But we in the United States, and I suspect in countries around the world, still see addiction as a moral failing as opposed to a medical issue. And let me answer that, because I can tell you, my mother didn't get up every day so that she could embarrass herself by 2 p.m. by her alcoholic drinking. My mother never wanted to go to political events and be inebriated because she couldn't control the amount of alcohol that she consumed. I don't know a single person with the disease of addiction who gets up in the morning and says, today I'm going to try to lose my job. I'm going to try to make all my family members hate me. I'm going to try to distance myself from all my friends. I'm going to put myself in jeopardy of being arrested. And I'm going to take the chances that I might kill myself. Because essentially, if you're a person with the disease of addiction, every single day, you're pushing away your family, you're pushing away your friends, You're jeopardizing your right to live as a free person, and you're putting yourself in jeopardy of dying. No rational person gets up in the morning and chooses to be addicted to drugs and alcohol. And we need to make sure that we fight that stigma. Now, in my country, stigma is so deep. But I have been fighting to implement non-discrimination against people with addiction. Because you see, I don't know whether I'm going to be able to change your mind about whether a disease of the brain called addiction is a medical issue or a moral issue. I don't know if I can do that. But I do know this much. I know that I can make it illegal to treat someone with addiction any differently than you would treat someone with any other illness of the body. So in my country, I have organized something akin to what we had during the civil rights movement in my country, where we had the NAACP. And the NAACP had a legal work group. And what did that legal work group do? They went around the country and they sued those violators of civil rights. And they chose which cases they were going to take up and where those cases were going to be heard, because they wanted to win, because they knew if they won in Alabama or won in Illinois or won in Colorado, it wouldn't be just a victory for Colorado or California or Illinois. It would be a victory for the whole country, because it would be establishing new standards and norms. So part of my admonition for us is to work with our judicial systems in our own countries, not only to have better pre-adjudication of those who are arrested for drug crimes, to try to get them treatment rather than put them in jail. Not only do we need to have drug courts, and we need to have pre-adjudication, we need to make sure that we help people get the support they need. And as I said, many in the recovery community, including myself, owed their early sobriety to the criminal justice system, because I did not want to get clean from drugs and alcohol. I had to, or else I was going to go to jail. So in my country, we call it a nudge from the judge. A nudge from the judge. And the way we need to treat this illness is we need to understand that people who need treatment the most are often the people who don't want treatment the most. My mother, my brother and sister and I had to go to court to get rights to save our mother's life. We had to get guardianship of my mother. Imagine being a son and needing to go and take parental rights away from your own mother. But because I did that with my brother and sister, my mother is alive today, and she's able to play with my 5 children because we were there to make sure she had to go to treatment. Now, people say, well, isn't that violating their civil liberties? And I say, We're violating people's right to make their own choices every day by arresting them and putting them in jail. Why not we do this in a more humane, civilized way and provide civil commitment statutes to allow us to better be able to make interventions with our loved ones? And of course, how are we going to use our other systems? If we're integrating mental health and addiction into our health care, if we're integrating it into our criminal justice system, we must start where it all begins, and that's in our education system. So I believe when we have this conference in 10 years from now, people are all going to be able to find their way here and, live their days, because they're going to be able to know how to drive their brains. We got the shuttle bus this morning, right? Our driver got a license to learn how to drive that shuttle bus over here to this convention center. When to turn right, when to turn left, when to stop, and when to go. I believe we need to teach our young people about the default mode of thinking, their fear response, their amygdalas, which overwhelm their prefrontal cortexes and rob their brains of their brain's ability to make rational decisions as opposed to impulsive decisions, compulsive decisions, obsessive decisions, all of which happen because too few of us realize that we need to work our mental fitness and our mental health in the same way we work our physical health and our physical fitness. And I saw some of you in the gym this morning at the Ritz-Carlton early this morning, pumping iron. And you know why we do that? Well, we want to look good, right? But we want to feel good. And we know that it only happens through practice and practice and practice. And that's the truth about working out our brains, too, and making sure we practice how to make decisions that can get us further in our lives, because we don't let our illnesses hijack our brains. Now, when we were coming to the end of the war in Iraq and Afghanistan, we had our soldiers coming home with post-traumatic stress and traumatic brain injury. And I often thought to myself, this is going to be the moment when the United States finally treats the brain as an injured organ, like they would any other organ that a veteran suffered injury to. And yet, we still have not done that. Our veterans are still in their own homes, sheltered away, locked up, with the shades drawn, and fearful of going outside. My friends, if veterans can be traumatized, who are grown men and women, imagine what our children go through every day when they grow up in a neighborhood where they see extreme poverty, extreme violence, extreme degradation, and domestic violence. If we think adults have post-traumatic stress, what do you think our children are often going through? So we need to protect our kids. We need to give them the flak jackets, the protection they need, by helping them understand how trauma affects their brain and giving them the tools to deal with stress and trauma so that they're less at risk. Not that we're going to make them all better, but because we can measurably make a difference in reducing the number of those children who suffer because they have no skills and no insight to how to address the trauma that they grow up with. I think when you talk about all of these things, it seems very complex. But in reality, we don't need to have all the answers mapped out, even though all of you have mapped out the answers. UNODC has mapped out all the answers. You have all the principles of best practices for prevention, treatment, and recovery. You've got it all figured out. What we need the most is the political will to implement those best practices. That's what we need the most. I thought we would have the political will when it came to our veterans, because in the United States, our veterans are held aloft, as they should be, for putting their lives on the line to defend freedom. But that was not enough. We ourselves need to do a better job at providing that political will for these standards to be implemented as they should in all areas of the spectrum of potential treatment, prevention, and recovery. So let me just say, intervening in addiction means you have to have insight into your illness. You have to be honest about what's going on. You have to see the elephant in the room. Visibility towards your illness, understanding it, transparency is the name, because shame and stigma keep people quiet and they hide people. And when people are hiding and their illnesses are secret, their illnesses get worse. As we say in recovery, you're only as sick as your secrets. So I know this conference is also going to focus somewhat on supply side. And I will tell you, we need the same thing on the supply side as we need on the demand side. On the demand side, we need to know that these are real illnesses and how to treat them. On the supply side, we need to have transparency as well. We need to know, especially in this world of synthetic drugs, where all the legal components and precursors are for fentanyl, for meth, for all the designer drugs, all of which are made from very legal chemicals. But we have to, as a world community, do a much better job tracking those chemicals so that we can interdict where people might be using those chemicals to make these potent drugs that are taking so many of our fellows' lives because of their lethality. And to do that, we need to track the way these chemicals get distributed and the way they get supplied. In my country, we had a pharmaceutical company called Purdue Pharma. It was a drug company that made OxyContin. In part, I became an addict not because of OxyContin. I had a genetic predisposition to become an addict. But when I took OxyContin, that sped up my addiction. Today, we have fentanyl, we have meth, we have potent addictive chemicals. And what we need is we need to have the ability to track when there's an oversupply of certain chemicals and where those chemicals are going. With the Purdue Pharma, we never tracked how much they were sending pills and where they were sending those pills to. We've lost millions of lives because the United States wasn't paying attention to what was going on right underneath their face. And I would say that is going to be the same challenge we have as an international community, to track these chemicals to make sure that they do not end up in places where they're going to be manufactured into synthetic drugs that kill your countrymen and women and my countrymen and women. And so we have to look for those big countries with large chemical industries. Now, India has all the willingness to do this, but they need the capacity to be able to drive the technical tracking and tracing of these chemicals. And we as an international community should support them. China has all the capacity, but none of the willingness. And we need to call China out on the transfer of so many of the basic precursor chemicals that get shipped and then remanufactured into fentanyl and meth and all of these designer drugs. These are just two examples of where on one side we need political pressure, on the other side we need technical assistance and capability. An organization like this can work on that with other international law enforcement and interdiction teams. But at the end of the day, you all are the ones that are going to help treat the people on the front lines who are suffering from the disease of addiction. And let me tell you, I want to thank you. You did not go into treating addiction because you thought you were going to get rich. You went into this field because it is the most underserved field in medicine, treating the most difficult patients there are to treat anywhere in the healthcare system. And you are doing God's work. In my own faith, there's a passage from Matthew 25, and it says, "Those that are there for the least one of these, my brothers and sisters, is there for me." And it's where Jesus says, I am where the most marginalized person is. I am where the leper is. I am where the most marginalized person is. And today, our modern day lepers are people with addiction. And I am imbued with my own faith, from my faith, that says that this is a moral calling, not just a medical calling. So I'm here to thank you, not just because of your medical and scientific training and expertise. I am here to thank you for the moral commitment that you have made to save each one of us. Because there, but for the grace of God, goes each one of us in being diagnosed with the disease of addiction and needing help. When no one else is there to answer, you, my friends, are there to answer the call. And I thank you for that. Thank you very much.